All right, let's talk about pregnancy cravings. But I'm not talking about the usual suspects, pickles and ice cream. I mean, the really strange ones. Have you ever heard of women craving things like clay or chalk? It's a real thing. And today we're going to unravel this mystery and figure out what's actually happening here. I know, it sounds totally bizarre, right? But it's a very real experience for so many women. And this is way more than just some quirky pregnancy story. It's actually a super complex and honestly fascinating signal that the body and mind are sending out. So let's break it down. What is that signal really trying to tell us?
So here's how we're going to tackle this. First, we'll give this craving a name. Then we'll get into the biology, these kind of confused signals the body sends out. After that, we'll look at the psychology of it, how the mind is just looking for some relief. We'll even touch on some deeper stuff, like cultural influences, talk about the risks, and finish up with what I think is the most important piece, empathy.
Okay, first things first, what do we even call this? This phenomenon has a proper name, so let's get into that and see just how common it actually is. The official medical term for this is pica. And yeah, it's exactly what it sounds like, a compulsion to eat things that aren't food, things that have absolutely zero nutritional value. And look, this isn't some rare, isolated thing. It's a global phenomenon. Seriously. Studies from all over the world, especially in parts of Africa and Asia, show that a lot of women go through this, usually in the second and third trimesters. It is way, way more common than you'd probably guess. So the big question is, why? What's driving this? Well, the first, and probably the most powerful explanation is biological. Think of it like an SOS signal from your body that's just gotten its wires a little bit crossed. Okay, this is where it gets really fascinating. When you're pregnant, your body's need for certain nutrients, especially things like iron and zinc, just skyrockets. So when those levels dip, the body basically sends out an alarm. But here's the catch. The brain doesn't always translate that alarm perfectly. So instead of making you crave a big juicy steak, it might make you crave the feeling of crunching ice or that dry, earthy texture of clay. And that really is the core of it. The craving isn't really for the thing itself. It's a desperate and, yeah, a little confused attempt to fix what's missing. The best evidence for this? Ice cravings. For so many women, the moment their iron levels are back to normal, poof, the craving just vanishes, almost overnight. But wait, a simple nutrient deficiency, that's only half the story. There's also a really powerful psychological piece to this puzzle that can turn that initial signal into a full-blown habit. Right, you're probably thinking, okay, if my body needs iron, why on earth am I craving clay? It's a great question, and the answer is all about the immediate sensory relief these things provide. It really comes down to satisfying a sensory need. Think about